Aloha guys, Dr. Thomas coming back at you. We have some more exciting, fascinating material today. We're going to go over chapter 16, Anatomy of the Heart. So tighten your belts and let's do it. Size and location of the human heart, located between the second rib and the fifth intercostal space. From here to here. Apex is down at the bottom. Base is up here, flattened at the top. Precordium anterior is the name for the anterior portion of the chest that overlays the heart. The heart's about the size of your fist. From what I've seen, when you take x-rays of a person, if you take a thoracic x-ray, you can see the heart, or see the shadow of it for sure, the outline. And what I've seen is fat people have like fat hearts, and tall, skinny, lean people have like long, lean, stretched out hearts. And, for whatever that's worth. Anatomically, this is called the mediastinum. It's just the name of that area. So no, the heart is not over here like everybody thinks. It's right in the center, but it's tilted. All right, there's three layers to the heart. Endocardium's on the inside. The muscle itself is called the myocardium, and the membrane, serous membrane around the outside is called the epicardium. Now, the heart has a sac around it called the pericardium. Yes, the heart is in a bag called the pericardium. It has three layers: epicardium, parietal pericardium, fibrous pericardium. Okay. And there's a little bit of fluid in there, 10 to 30 milliliters of fluid in that precardial space. Why? To keep it lubricated, so that heart can pump. Boom, boom, boom. The heart is two pumps in one. It's a right-sided pump that pumps it back and forth from the lungs and back, and the left side of the heart which pumps it out into the body. So there's a pulmonary circulation, pulmonary meaning lungs. It pumps to the lungs so it can get reoxygenated, and then when it goes out into the body, it's called the systemic circulation. Okay? The right side of the heart pumps it to the lungs. Boom, boom, boom. Left side of the heart pumps it out to the body, into the systemic circulation. Oxygenated blood is always pictured as being red. Deoxygenated blood is blue. So blood going to the lungs is deoxygenated because it just returned from the body. Once it passes through the lungs, it gets reoxygenated, turns nice and red, and then goes back in, to the left side of the heart to be pumped into the systemic circulation. Okay, now I knew we're moving along rather quickly, but we have to. How many chambers are there? There are 4 chambers in the heart. There are 2 atria and 2 ventricles. 2 atria, 2 ventricles. The atria are the upper chambers. The ventricles are the lower chambers. So there's a right atrium and a right ventricle, and there's a left atrium and a left ventricle. Now, if you don't know this, guys, there is no reason to go any further. Great vessels. The big, huge veins that bring blood back from the body into the heart is called the superior and inferior vena cava. There's a pulmonary trunk going to the lungs. Pulmonary veins bringing blood back from the lungs into the heart. And then the big artery that leaves the left ventricle and goes out into the systemic circulation is called the aorta. Now, I think it goes without saying that all this is really important. Now, guys, I know this. When you first see this, you want to flip out. Don't worry. Dr. Tom will take you through it just like I have before. Okay, this is where they've cut off part of the heart so you can see inside the chambers. Here's the right side of the heart. There's the left side of the heart. Now, I know what you're thinking. You're saying, Dr. Tom, if it's the right side, why are you pointing to the left? Because it's always the patient's left and the patient's right, not our left and our right. So if this was a patient standing here, this is the right side because it's his or her right. You dig that? And left because it's his or her left side. Okay, there's a right atrium, right ventricle, left atrium, left ventricle. The left ventricle is thicker and more muscular. That's why this muscular wall is thicker, because it has to pump it out all through the body. The right ventricle just pumps it to the lungs. Okay, so blood returns from the body after it's circulated all over into the superior vena cava and the inferior vena cava. These big gigantic veins Veins always bring blood back to the heart. Arteries always take it away from the heart. So the superior and inferior vena cava empty into the right atrium. When the right atrium pumps, contracts, go boom, it forces it down through a valve into the right ventricle. When the right ventricle pumps, it goes out this pulmonary trunk to the right and left lungs on its journey to get oxygenated. Okay? When it comes back from the lungs, it enters back in through the right and left pulmonary veins into the left atrium. When the left atrium contracts, it goes through a valve here, called the mitral valve, into the left ventricle. When the left ventricle contracts, the blood goes out. This is called the aortic arch. These arteries go up to the head and the brain, comes down below or behind the heart, posterior to it, and down the abdomen into the rest of the body. The atria contract, blob, and then the ventricles contract, blob. The valves direct the flow of blood in the proper way. 2 atria, 2 ventricles. Right side of the heart pumps to the lungs, left side of the heart pumps into the systemic circulation. It goes without saying, you have to know all this. Oxygenated blood is always represented as red, deoxygenated blue. Okay, there are 4 valves in the heart. The first ones we're going to talk about are the atrioventricular valves. Just like the name says, it's a valve between an atrium and the ventricle on each side. The one on the right side is called the tricuspid valve. The one on the left side is called the bicuspid, or more commonly, the mitral valve. Now this is an example. I'm going to put the word mitral here and bicuspid here. Why? Because it's a million times more common for it to be called mitral. Why don't the authors of it do that? I don't know. They're dipshits. I don't know. They're brilliant people. I'm just fussing, guys, just to be making a joke. But I would do. I mean, you know, the thing that's the most common is what needs to be taught first. Cusp attached to the ventricular walls by chordae tendineae. All right, let's look at these here valves. Here's tricuspid. Here's the mitral. See these strings? These are called chordae tendineae. They attach to the walls of the endocardium, and they keep the valve from turning inside out. Okay? Tricuspid valve, mitral valve. Tricuspid valve, mitral valve. Are these important to know? Do you have to know them? Yes. These are super important. Now, there are 2 semilunar valves. The pulmonary means lungs, between the right ventricle, the pulmonary artery, and the aortic valve is between the left ventricle and the aorta. Those are the 4 valves. So we have the 2 atrioventricular valves, the tricuspid and mitral. We have the 2 semilunar valves, the pulmonic and the aortic valve. Those 4 valves are what direct blood in the proper flow. That's also what makes the sounds of the heart beating. When they flap together, lub, dub, 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 slap, slap, that's what makes the sound that you hear with a stethoscope. Here it talks about it, lub, dub, lub, dub. Murmurs are areas of turbulent blood flow where the valve is not sealing all the way. There's different, some murmurs are of no consequence clinically at all, some are quite serious. S1 is the sound of the AV valves flapping shut. S2 is the sound of the semilunar valves flapping shut. Blood flow through the heart. Right atrium, okay, comes into the right atrium from the inferior and superior vena cava. Goes through the tricuspid valve into the right ventricle. Right ventricle contracts. Blood goes out the pulmonic valve, pulmonary artery to the lungs, and then ultimately returns through the 4 pulmonary veins on its way back to the heart from the lungs. The pulmonary veins empty into the left atrium. Left atrium, the blood flows down from it through the mitral valve. See, they did it again. Into the left ventricle, and then out the aortic valve into the aorta and out to the systemic circulation. Blood going to the lungs is deoxygenated, even though it's in arteries, and blood coming back from the lungs is oxygenated, even though it's in veins, pulmonary veins. This is the only exception in the body like this. Any other cases, arteries carry oxygenated blood and veins carry deoxygenated. This is the one exception because it's coming back from the lungs. Blood flow in shunts. A shunt is a disruption of normal blood flow. Right to left shunt diverts blood from the right heart to the left heart. Left to right shunt does just the opposite. I wish they wouldn't get into that. That's something that's important, but not enough. Okay, the myocardium is a unique muscle in the body. It beats all by itself, but it has to have lots of blood and oxygen. These coronary arteries are what feed the heart muscle. Right coronary artery, see? Left coronary artery. And then there are also coronary veins. The arteries branch off the aorta. Guys, when one of these arteries gets plugged up, that's what a heart attack is. Usually with a clot. But when these arteries plug up or get a plug in them, that, my friends, is a myocardial infarction or heart attack. The biggest killer, basically, that and strokes in modern westernized type countries, industrialized. So, what feeds the heart muscle? The coronary arteries. What feeds the heart muscle? The coronary arteries. The coronary arteries. It seems to me like they are prone to get clogged up with plaquing, but maybe it's just because they have such a crucial task. Characteristics of coronary blood flow. Flow can increase up to 4 or 5 times during exertion. When you're running or something. Flow is greatest during myocardial relaxation. Coronary arteries can form anastomosis, where they grow into each other. Sometimes, guys, you'll have a neovascularization occur when these things are partially clogged up and all. Because this is big time important. I mean, if that heart muscle doesn't get enough oxygen, it's going to quit beating and you're going to quit ceasing to exist on this plane. Okay, ischemia is a lack of blood flow and oxygen. An infarction is an interruption in blood flow. Ischemia, diminished blood flow and oxygen deprivation. Why? Probably, well, 2 reasons. One is either you're not getting enough blood flow, or the blood flow you're getting doesn't have enough oxygen in it. This causes chest pain, which is called angina or angina. Myocardial infarction, MI, it's always abbreviated that, is a heart attack. Diagnostic test for it, creatinine phosphokinase, CPK, AST, LDH. These are all common lab tests they do, guys, to see if there's levels that are abnormal in the blood. Some people have heart attacks and don't know they had one. Some people have heart attacks and are dead when they hit the floor. So it depends on how much of the blood flow, guys, is compromised. Cardiac enzymes and leaky cells. If dead myocardial cells leak enzymes in the blood, plasma elevations, cardiac enzymes arise, troponin leaks in the blood. Diagnostic tool. I'm going to try to finish up here, guys, if we can. We're not going to be able to. Hell, I got to explain this. Okay. Cardiac muscle beats all by itself, but it has to have nerve innervation to regulate the beat. The heart has its own natural pacemaker called the SA node, sinoatrial node. That's what makes the signal. Goes down through the AV node, through the bundle of His, and through the Purkinje fibers. And I know what you're thinking. Dr. Tom, do we really have to know all this? Yes. When you start doing EKGs, you have to know all this stuff. All right, here it is. Here's the SA node, the natural pacemaker of the heart. It makes the signal, goes down nerves to the AV node, atrioventricular node. Then it goes down. It's called the bundle of His. Not His, His. That's the way it's always pronounced. I know you're thinking, but if it's His, it should have 2 S's. Yeah, I know, but it doesn't. But I guarantee you, it's pronounced the bundle of His. How do you know? Because I've studied this till it's coming out my ears. I had this in school in great detail, guys. You have a five-week course. We studied it for like 2 years. Okay. Then we have a right and left bundle branch, and they recurve up into the myocardium as the Purkinje fibers. As this electrical nerve signal travels through this area, it causes it to contract. And that's what they measure on an EKG right here. We're running out of time. Oh, we're only like, oh my God, we only need 3 more charts. All right, Dr. Tom's out of here. Bye.